Now, welcome back to the AM show. Let's move into our big stories. And over the weekend, we read a story that, got all of us talking. Now, a medical doctor is said to have lost his life tragically when his heart had a failure. Despite being airlifted to Accra for thorough care, death laid its icy hands on him even before he could get that care that he was looking for. Some healthcare workers are asking government to prioritize the provision of basic health amenities in the country. Now, we've been joined by Reginald Sechi Brown. He's chairperson of the Early Career Pharmaceutical Group, of the Pharmaceutical Society of Ghana. And he wrote that particular piece that we read, all of us read on social media. Thanks for joining us here, sir. Now, we want to really understand, the issues. Run us through what you said was needed to have been done that could not have, been gotten at the Konfo Teaching Hospital that resulted in him being airlifted to Accra.
Okay, thank you for this platform. And as you rightly said, this weekend has been one of a morbid situation for Ghanaians. Particularly in Black, because this is a national tragedy which shouldn't have happened. And it has become so normalized that Ghanaians have become desensitized from the situation. So the late Dr. Kwame Ofori was required a service in the Konfo Teaching Hospital last week. Interestingly, the whole of the Ashanti region didn't have what we call the cath lab, which means that he needed to be flown all the way into Accra. Now, when you have what we call an MI, a myocardial infarction, or what our people would normally call a heart attack, you need what we call a PCI, so to speak, so that it helps free the system in a way such that whatever blockade that the individual is facing would be resolved. Strangely enough, this system is not available in the whole of the Ashanti region. And you can imagine this is just one doctor, critical doctor we have lost. You can imagine the number of Ghanaians we have lost as a result of such intervention in the Ashanti region. And this situation does not only pertain in the Ashanti region, it's pervasive in other regions as well. If you check the statistics, you realize that not only the Ashanti region, it's not only the Ashanti region that this service, the cath lab service is unavailable, but in the northern regions as well, outside of Accra. So currently, aside Accra, where you have about 2 or 3 places having these services, any other places outside of Accra where you require this service, it means that you have to be flown into Accra. I don't understand why something like this should happen in a country of 30+ million people. So this is the situation, the sequence of events. Of course, I recognize that the family is still, this is a shock to all of us. So not to go into things that would open fresh wounds, but just to say that a cath lab would have been very critical in intervening in this situation. Unfortunately, that was not available. But of course, this speaks to a more broader issue, and I'm sure as the conversation goes on, we'll be able to unpack some of these things.
I've also read elsewhere that this is a doctor who was saving people from dying through the same heart attack. Is that true?
Rightly so. Imagine an emergency specialist who has dedicated his life, and this is his life work. He has dedicated his life to saving people, and he ends up in a very situation where that one time that his country was supposed to come to his aid, we were unable to do it because the services were unavailable. Now, this has been happening for a very long time. I've seen quite a number of comments from people on social media that, is it the case that we've lost one of us? That's why the conversation has become topical. That is not the case. As far back, we've lost several prominent Ghanaians. We've also lost various individuals as well. prime cases that comes easily to mind. PV, the politician PV, we lost him as a result of some of these lapses in our system. We also, in the past, not too long ago, not to open any fresh national wounds, but remember the issue of our late vice president's situation in a gym. Basic amenities that could have been provided in such a setting. Due diligence should have been done in places like that. Nothing was done. And then we've had a whole certain precedent. How did he end up? How did his situation end up? Now, let's not forget, a few years back, we had a 70-year-old man who was taken to about 7 different facilities and he ended up dying. Now, these are the pervasive systemic issues that have happened over the period. We have become too acclimatized. We have become too desensitized and normalized death so much so that when now people pass on, it becomes we invoke the cliche that it is God who gives and it is God who takes. But that's marks of mediocrity, because the very God who imbues us with that knowledge to be able to say that, yes, he's the one who gave and he's the one who took, is the same God that has given people systems to be running. And these are not rocket. This is not rocket science. These are systems that if they were in place, this doctor's life could have been saved. I mean, not to maybe blow this issue out of proportion, but we know the overlord, assuming the overlord in the Ashanti region had faced a similar situation, what would have been what would have happened? This today it is Dr. Kwame Eduofori whose situation has become topical. But what if it was the overlord of the Ashanti region?
The reason I asked you if it's true that he's been doing that, how was he able to save people's lives from heart attack without that particular lab you are referring to?
So not to lump the issues together, there are various kinds of cardiovascular or heart-related issues that people face every now and then. Now, when you face this situation, time is of the essence. Time is of the essence. I would mention, for instance, sometime last year, in the first quarter of last year, when a very close person to me suffered a very critical situation. And the time we needed some maximum 1.5, 2 hours to intervene. It was a disaster trying to even find an ambulance. In his situation, not every patient who would present with an MI, but if that patient does present with an MI and he requires a PCI, then of course the criticality or the seminality of a cath lab and the various instruments that are supposed to be put in place has to be there. But of course, he has been saving people who present with all kinds of heart-related issues. But in situations where you need a cath lab, then it's like asking a surgeon to perform a surgery and you have tied his hands to his back. Let me just remind us. If you remember very recently, an issue happened in the Tamale Teaching Hospital and the Minister of Health had to intervene. Now, the situation was not properly dealt with in a sense that the doctor at the time, I think Dr. Valentine and his team, were trying to explain that what they needed actually to do their work was not available. And that's the thing about the health system. You cannot conjure a system into existence if it doesn't exist. And that's exactly what happened in the case of Dr. Eduofori. So in patient situations where they are able to intervene, they will be able to do something. But where there's a critical need of a cath lab, which it has to and must exist, you cannot perform any miracle in such cases. So yes, patients who would present, and he as a doctor, as an emergency physician, has been seeing them on so many cases, they will do what is humanly possible. And then let's not also forget that there are not too many of these emergency physicians around. And when things like this, misfortunes like this happen, those around should be able to, first of all, recognize what is happening to you. That's one. And they should be able, their first 2-3 steps or procedures that they would take would determine whether you live or you die. So if this popular phrase that we normally use, Osafon Sanoho, right, physician heal thyself. You could be healing people because you have the knowledge, but if the system does not exist in your hour of need, the system would not kick in, and that's exactly what happened in this case.
Okay, so it is not the issue of the lack of skilled personnel. It's rather the system, the equipment that is not available, right?
No, it's a blend of both. It's a blend of both. You need to first of all check how many emergency specialists or physicians do we have in country. That's one thing we need to check. And if whenever you even check that, you realize that there's a disproportionate representation. Most of them would sit in Accra. Usually you have about 80% of them sitting in Accra, and then you have a few of them sitting in Ashanti region. In the other regions, they are up to their faith, and that is what has been transpiring across the health space over a very long period. And this brings to mind the issue about the campaign we are even doing about high pharmacists now. You would not believe it if I tell you for the last 5 years, the Ghana Health Service has not recruited pharmacists. 5 years. 5 years. So if you should ask yourself, what is happening within the health system if pharmacists have not been recruited for 5 years? And that's the same thing. In our national planning, strategic planning, we should be able to ask ourselves, if our population is 30 plus million, how many physicians do we need to be able to manage this population bulge? I think the last time I checked, our population increase is just about 2.1%. So we should be able to plan and know how things would turn out. Last week, I was in Ho for the better part of last week, and I realized that there's a gap, for instance, in at the health center level, there's a gap of almost 4,000 plus pharmacy technicians at that within that space. Who is accounting to who? And this is the same thing. So the first thing is there's a question of the availability of the skill. There are emergency physicians who are available, yes, but how many do we need to be able to run a robust emergency system? That's the first question. And then two, the conversation about having a cath lab. Accra cannot be the only place having a cath lab. Ashanti region is critical. Every single region, we now have 16 regions. So if we are being fair, at least every single region should be able to have one. If it should cost you about $500,000 to be able to mount one, we give all kinds of flimsy waivers, car waivers to politicians, and these monies can actually help set up these labs. So it's a question of skill, it's a question of availability of a system, and then it's a question of prioritizing to ensure that every single region matters and counts when it comes to these issues.
Now, let's go through what you need, you've proposed that needs to be done to change. You are proposing that there should be a moratorium on Agenda 111, for the next 18 months. Why do you want us to do this?
Well, you see, the strategy or what informs health policy in Ghana is sometimes very bizarre. And when you read the IMF 2023 report, titled The Request for an Agreement under the Extended Credit Facility, right? The IMF, it's about a 156-page document. You realize that on page 62, to be precise, there was a conversation around restructuring or recalibrating the duration for the Agenda 11 project. And I want to read verbatim so that people will know that these suggestions are not being made out of a vacuum. So in that document, right, categorically, the government said that the government flagship programs, including the One Village, One Dam, the One District, One Warehouse, and the Infrastructure for Poverty Eradication, that is the IPEP, will also be reviewed and streamlined. Agenda 111 will be reprogrammed to be completed over 5 years, in this case 2022 to 2027, in line with the budget allocations to the GIIF from the ABFA for health infrastructure. It's not Reginald saying it. This is in black and white print, and this was in the IMF document, 156-page document. Now, some of us have our own personal opinions about the project. Because when you want to undertake such a massive
Regional
analysis,
good.
the health system. And the health system at the time, there are obvious gaps. There will always be gaps within the healthcare system. Why didn't the government at minimum say that, look, instead of saying we want to do an agenda 111, it started in trading. And then they wanted to expand it, and it didn't even start as an agenda 111. Formerly, it was about 88 or 80 hospitals, and then it moved to 111. Of course, it sounded nice in our ears. It sounded nice as a sloganeering epithet, so to speak. So the whole point was this: if we wanted to intervene or wanted to make any critical intervention in the healthcare landscape, we needed to be able to diagnose what was required in the health system. Critical human resource had not been employed over 5 or 6 years. We still have nurses, we still have doctors, we still have allied health who are consistently agitating for recruitment. That was one thing we could have done instead of even starting the agenda 111. And then 2, we could have also looked at the already existing hospitals. If we had done that, the Tamale incident wouldn't have happened, where the minister had to now go and intervene, and then later a piecemeal donation was done. That wouldn't have happened because we would have revamped those institutions, the teaching hospitals, to ensure that they were running at full capacity. So the question of postponing the Agenda 111 to say 2 years, it's not a conversation of saying we want a huge project such as that to be truncated. No. But the realities or the exigencies of the time does not call for such kind of intervention. There were other critical things that the monies could have been used for. And for instance,
but if you look at Ghana, couldn't we, looking at, you acknowledge that the Agenda 111 is a project that should not be left off the hook. Can't we do that in tandem with providing the basic things you're calling for? Because the focus of Agenda 111, as they say, was to get healthcare closer to the people. For example, I know of Takrady very well. If you're moving from, say, Apimenim or, say, Abra to Efiankwanta, it will take you no less than 2 hours. But if you look at where they've situated the Agenda 111 in Bukro, for example, it could take you less than an hour to get there. So can't we as a country do that in tandem with providing the basic things that we need in the medical sector?
You hit the nail right on the head. So there were certain nodal areas, and you've cited a very classic example. There were certain nodal areas in the country which obviously needed some kind of health institutions being set up to be able to cater for the people. So that's a fair point. But must we have done 111 facilities at the scale at which we did? We could have prioritized, because at the time, we have been in an IMF conditionality situation for a very long time. So we didn't have the full pot of money to be able to dispense at will. So then you have to prioritize. If I needed to put health institutions in certain nodal areas in the country, where would I put those institutions? That is the fundamental question we needed to ask ourselves. But the kind of the zealous job that we wanted to say, we were doing 111 institutions, that was neither here nor there. So we could have done that, but not necessarily 111 institutions. And then now we could have asked ourselves, let's do a SWOT analysis of all the teaching hospitals. Let's do a SWOT analysis of all the regional and district hospitals. What are the human capital needs of these institutions? What are the equipment or the resource needs for these institutions? And then we provide, in tandem with ensuring that critical infrastructure is strategically placed across the country to ensure equitable distribution or access to health. So that was what we could have done. Yeah. But for some reason, for some very bizarre reason, we decided that we wanted to do this Agenda 111, even though we knew we couldn't have finalized it at the scale at which we wanted to do that.
Okay. Interesting point you raised there. Now, number 2 on your to-do list is to launch a national equipment mobilization campaign. And you are proposing to government that there should be a government-led, globally supported Ghana Health Infrastructure Emergency Fund. And this should invite contributions from bilateral partners, diaspora networks, and philanthropic entities to purchase critical diagnostic and therapeutic equipment, including favorite cath labs. Now, if you look at the third and fourth point, and I want us to get to it, it says, disclose the current state of healthcare, a state of the health system address. Ghanaians deserve to know the actual conditions of their health infrastructure. Let's look at point 4, because we need a national televised address backed by verified data to outline, 1, where critical gaps exist: beds, cath labs, oxygen plant, imaging equipment, amongst others; regional disparities in emergency care; the government's roadmap for fixing these deficits over the next 24 months. Very critical proposals there. It says, 4, set up at least 4 regional cath labs within 12 months. We propose immediate investment in setting up cath labs in 4 regions: Konfano Teaching Hospital, Ashanti, Tamale Teaching Hospital, Northern, Cape Coast Teaching Hospital, Central, and Ho Teaching Hospital. That's in Volta. Okay. 5, integrate pharmacists into emergency and specialist care systems. Hashtag hire pharmacists now. Now, I mean, with your cath labs and the distribution, what is the reasoning behind how you've distributed them?
Yes, so you see, already Accra has cath labs in Accra. Now my proposal is that we explore the possibility of setting up cath labs in the Ashanti region, and obviously this will be stationed in the Konfanochi Teaching Hospital. So that will serve those within that enclave. Then you have Tamale. Now we have the northern belt. The northern belt would serve as once you have a cath lab in Tamale, it will serve the whole of the northern belt. So once it sits at Tamale Teaching Hospital, it would have been ideal, of course, because the north is, I mean, it's a huge span of land. But of course, once it's in Tamale, at least it's far better than if the person has to be flown all the way to Accra. So it serves the northern belt. Okay. Then Cape Coast, the centrality of Cape Coast. So Cape Coast Teaching Hospital would be able to at least feed Western region as well. In fact, it will even be critical to have one in the Western region, given the population bulge there as well, and then the whole teaching hospital. So you can see that there's more or less like a triangular arrangement of where these cath labs will sit, so that whichever part of the country you find yourself, it must not necessarily be the case that you have to be transported to Accra. That is the whole idea. Okay. Accra should not be at the heart of our healthcare system. Yes, we can have all kinds of critical investments in Accra, but at the end of the day, bottom line is that every region deserves better. Okay. If we cannot provide 16 cath labs, which I believe we should be able to, at minimum, we should be able to put them in these critical regions to ensure that they serve the good people of this country. You mentioned the point about the resource, mobilizing the equipments across board. Before that, not to put the cart before the horse, there's a critical conversation we need to have about this whole emergency system. We need to have a mindset change about the way we manage emergency in this country. I remember last year, before even then, some of us had written extensively. I remember I had written a piece beseeching the University of Ghana and a couple of the Ministry of Education some years back that we should incorporate the training of basic life support training right in school, so that everyone who passes through our educational system has a fair idea of what an emergency is, what it takes to be able to administer a basic life support, assuming somebody collapses in a place like Makola. For some reason, we've not been able to do that. In other countries, this is basic training that is done. Fortunately, last year, we had the first cohort of young pharmacists that were able to go through such a training. And I believe that this should be something, a low-hanging fruit, that we should be able to take place. Then, if an emergency should happen, it should be on the lip of every single Ghanaian to know what number to call. And before knowing the number to call, you should even know what to, at minimum, you should be able to do. If it's a stroke the person is experiencing, time is of the essence. So if the person has no clue that this is a sign of a stroke, If you go to a place like Spain, they have what they call the stroke code. In other countries, they do.
Okay.
So when there's stroke, a protocol kicks in. But it's like we consistently align everything to, we leave everything to God. And I don't think that's fair.
Okay. Reginald, I mean, solid point you've raised there, and I hope that government will listen to your call and listen to all of us and intervene so that we can get it. And because you said it takes $500,000 to set up one, right?
At minimum, to, it's setting up this lab is one thing. You can, so there's the acquisition cost of the devices and the setup, $500,000. But of course, you have maintenance costs that will come along the line. And that is where I want to maybe make my most fundamental point, that in all this, we are calling government. There's an element we have left when in this discussion over the period. In the hospitals that these things are required. Internally generated funds are also critical. There should be performance contracts for every single CEO in any hospital, such that if people die on account of the absence of these things, people have to be fired.
Okay.
People have to be fired.
Okay.
The minister cannot be anywhere. In as much as we are pushing the minister to respond, to intervene, within the hospital, there's a leadership structure, and people have to be held to account. People have to deliver.
Okay. Reginald, I'm grateful to you for sharing with us your thought this morning. Reginald Sechi Brown, the chairperson of the Early Career Pharmaceutical Group of the Pharmaceutical Society of Ghana, and government. This is a call to you to ensure that, you're helping in getting us the solutions that we're looking for. How our health sector can get all of those equipment to help in how we can, solve some of these challenges. But as you do it, please, he enumerated some regions, include Western, because Western will take care of the Western North and the Western region. We are quite a large space of land, and so others to it. I mean, if Nkwanta Regional Hospital can accommodate that particular facility, and it would help all of us in the Western and Western North regions. Well, so.